The world is standing on the edge of another public health disaster, and this time, it's not hypothetical. The avian influenza virus, H5N1, is no longer confined to poultry farms and isolated wild bird populations. It has entered a new, far more dangerous phase, one that threatens not only our food systems, but also the very stability of global public health. The phrase used by the UN's Food and Agriculture Organization is chilling but accurate. This is an unprecedented outbreak. And the warning signs are not just present, they are screaming. Already, the virus has caused the death or destruction of hundreds of millions of birds globally. In the United States alone, over 166 million birds have been culled due to outbreaks, with devastating consequences for agriculture, food prices, and ecological systems. Egg prices reached historic highs this February, but the issue isn't just economic, it's structural. A virus capable of such rapid and widespread devastation in animals is now spilling over with increasing frequency into mammals. And that changes everything. More than 243 herds of dairy cattle in the US have now tested positive for H5N1. That statistic should terrify anyone paying attention. This is not just a bird disease anymore. This is a virus learning, mutating, adapting to survive in new hosts. And the more species it infects, the higher the probability that it acquires the exact mutations needed to jump efficiently from human to human. Virologist Pierre Bassir warned recently that the virus now possesses all the tools necessary to become a pandemic. This is not theoretical posturing. We've seen this before. 4 pandemics in the last century were caused by influenza viruses of avian origin. H5N1 already shares several of their key traits: rapid mutation, broad host range, and occasional but increasingly frequent zoonotic transmission. The 1918 flu pandemic, the deadliest in modern history, began with similar spillover events. History is not just repeating itself, it's accelerating. In Canada, a child infected with a mutated variant of H5N1 had to be hospitalized for 2 months in critical condition. In Louisiana, the first confirmed human death from the virus in this wave has already occurred. These are not isolated cases. They are the warning flares of something much larger. And as long as this virus is allowed to continue circulating and mutating, unimpeded in livestock and wildlife, it's only a matter of time before human-to-human transmission becomes a reality. The worst-case scenario? A highly lethal, highly transmissible strain emerges, quietly, perhaps at first, in a remote area or a dense urban center. A virus that evades the immune system just long enough to spread across borders. Unlike COVID-19, we may not be as lucky with asymptomatic or mild cases. H5N1 has historically shown a mortality rate of over 50% in known human cases. Let that sink in. If that number even remotely holds in a future outbreak with human-to-human transmission, the consequences will dwarf anything we experienced in 2020. And we are woefully unprepared. Vaccination strategies are limited and slow. Surveillance systems are already overwhelmed. Farmers and rural workers are often underprotected and underinformed. We are allowing a virus with global pandemic potential to circulate in animals with minimal intervention, hoping that the worst won't happen.
But hope is not a strategy.
It's a gamble, and one that we may lose. Adding to the danger is the virus's impact on wild bird populations. At least 300 species of wild birds have been affected since 2021, creating another avenue of viral spread across continents. Birds migrate. They cross oceans, national borders, and biosecurity zones. And they are spreading the virus with them. This is not a problem that can be contained within farms. It is ecological. It is global. And then there's the biodiversity crisis. The death toll in birds, both domestic and wild, isn't just a farming problem, it's an environmental one. We are watching species pushed closer to extinction, ecosystems destabilized, and food webs disrupted. The virus is not just attacking chickens, it's attacking ecological resilience. Yet, the response remains tepid. Political will is weak. Resources are stretched thin. And public attention, distracted by countless other crises, is not yet fully focused on what could soon become the crisis of the decade. The signs are here. The scientists are speaking up. The data is public. And still we hesitate. The transition of H5N1 into mammalian hosts is not just a scientific milestone, it is a red alert. Once influenza viruses acquire sustained transmission in mammals, they are one step closer to adapting to humans. That's how it happens. That's how pandemics begin, not with a bang, but with a mutation. Not with a siren, but with a cough in a hospital somewhere that no one traces in time. Let's be absolutely clear. We may already be too late to prevent the next pandemic, but we're not too late to mitigate it. We need immediate, aggressive global action to contain the spread in animal populations. We need full-scale surveillance in livestock and wildlife. We need emergency investment in vaccine research now, not after the first 10,000 cases. We need to treat every new human infection as a public health emergency. If we don't, we are looking at a crisis that could surpass COVID-19 in lethality, scope, and long-term impact. This isn't fear-mongering. This is fact-based warning, and it may be the last one we get.